Hi, I'm Dr. Rich Sadowski at Commerce Chiropractic here in Commerce Township, and I'm going to show you how we assess and treat neck pain. So the first thing we're going to do here is we're going to gently tilt patient's head to both sides, and we're going to check to see how his neck moves. Now what we're looking for here is most of the side bending in the neck comes from, well, there's 7 bones here in the neck, comes from like the 3rd through the 7th. So when we do this test, we're checking to see for symmetry. Hey, is he moving the same on the right side as the left side? So on this patient, we got real great movement to the right, and when we go to the left, he's basically stuck here. So he's not moving at all. So what we're gonna do is we're gonna feel for the 3rd bone first, and right about there, a little tender. And we're going to put our instrument on the 2nd setting. We adjust with the Impulse IQ adjusting instrument. What this instrument does is a quick mechanical thrust, kind of like a quick tapping, anywhere from 6 to 12 hits per second to help restore the motion here in the joint and in the spine. The instrument has a built-in sensor, which is an accelerometer, which measures the motion of the joint, speeds up and slows down to match that motion, and when it reads that motion has been restored, it beeps and turns off for us. It's one of the safest and one of the most researched ways to adjust. So we're going to contact that area. Ooh, took quite a bit there. What that's telling me is that that area was pretty jammed up, so the instrument had to go in there and keep tapping it until it finally restored the motion. So now we're going to go back and recheck to see if it worked. Got great motion to the right and considerable motion back on the left-hand side. So now we've restored motion as his neck's trying to bend side to side. We are now going to check for rotation. Most of that happens with the top couple bones in the neck. So we're going to check by gently rotating. And again, I want the patient to not do anything. We don't want his muscles to try to bend around things or compensate. So we want this to be a passive test, so just totally relax. We're going to gently rotate. Rotate. He's rotating pretty good to the left, and he's a little bit tight on the right, so we're going to go in there and make that adjustment. Same kind of thing. And that rang really quick because it wasn't that fixated. Recheck, and he's like a bobblehead, which is really good. So now that motion has been restored, now his neck's going to move properly. So all these muscles that help hold up his head are going to now be allowed to relax because they don't have to try to tug on things that aren't working properly or aren't moving properly. Kind of like a car door, if the hinges are rusty, it takes a lot more force to try to open and close that door. So we're also going to check the muscles as they come down from the neck to the upper back, because oftentimes when people get neck pain, they usually feel a lot of stiffness in their shoulders and upper back. So we're going to check for that, and we can feel some tenderness right about there. So same thing, we're going to put our instrument on that area, restore the motion. Good. And we're going to check the other side, and almost the same area here. We're going to make that adjustment just on the right side. And that. And once that motion is restored, we have restored function to the neck, both in rotation and lateral bending. So now his head and neck are moving properly. Then all these muscles that join up through the upper back now can start to work properly again. Because most of the middle back pain that people experience is really coming from the neck, the muscles that join here. So that's how we treat and take care of and evaluate neck issues.